Hello everybody, welcome to Dr. Akinclicks and I am Dr. Akin. Today I am going to share with you on COVID-19 related update for India and especially in my state of India, that is Arunachal Pradesh. India detected the first case of COVID-19 disease on 27th January 2020. So today it has been more than 1 year and 6 months of COVID-19 disease in India. The first wave of COVID-19 disease in India was uneventful because of the very strict nationwide lockdown imposed by India. The second wave, especially the month of April and May 2021, has been very difficult days for the people of India, and we know that there was so much of distress in the nation because many people had died in the second wave, which was very severe in the month of April and May 2021. From the first wave of COVID-19 disease, the government and the medical authorities have been always saying people to take care of themselves, advising them to wear masks, maintain social distances, maintain the cough etiquette, and to take care of themselves and others by following the COVID-19 appropriate behavior. The people of India have been very cooperative in the last 1 year and 6 months to the government, and they have been following the protocols that are advised by the government from time to time, and they are also following the safety measures against COVID-19 disease that have been told by the government to the citizens. But it is also noticed by me and many of us that there are certain group or people who go around and say, COVID is nothing, COVID is a very simple disease, COVID is a usual viral flu, and why to bother? And they even tell us that why you are imposing unnecessary restrictions on us, and it's a viral flu and like any other flu, why you are bothering and why you are troubling us? As a healthcare worker and as a doctor who is on field overseeing the COVID-19 related health measures, and myself every day see patients who turn out to be positive after I have advised them for test, or after or before seeing me, many of my patients have got COVID-19 disease. And I also know that many people, those who get tested positive with COVID-19 disease, are having severe complications related to post-COVID infections. And when people say that COVID-19 is a simple viral flu and why you are bothering us by imposing various restrictions, and people even go to the extent of making fun of the healthcare workers and doctors, and they say COVID-19 disease is a joke. When I hear such things and when my colleagues hear such things, we feel very sad and we feel very upset. I feel that when somebody says to us that COVID-19 is a joke, COVID-19 is a simple viral flu, and why are you imposing restrictions on our movement? Why are you enforcing containment zones in our area? And why are you always after us, asking us to wear masks, to maintain social distancing? I feel when people make such comments, it is a dishonor and disrespect to the departed souls, those who have succumbed to this COVID-19 disease, and it is a dishonor to the families of those people who have lost their near and dear one in this pandemic. So I wish to tell today that from the beginning of the outbreak of COVID-19 disease in India, the doctors always said that this is a disease that we have to be careful. This is a pandemic. What do we mean by pandemic? Pandemic is that a disease that has affected everybody in the world and no one can escape this illness. And the pandemic is such a that the disease is rampant in the community, disease is rampant in the community, and the disease is everywhere. That is the meaning and severity of the pandemic. So I want to tell once again that never ever the medical community or the scientific community during this pandemic say that anyone or everyone who gets this disease will die. No one said that those who are tested or those who will get COVID-19 disease will die. No one said. And people also make sarcastic comment to us and to health worker and to the authorities by telling us that it's a simple flu, and without even any medication people are getting well. And what joke you are playing to us, they tell to us, to health workers. It is nothing. Why you are imposing all these unnecessary restrictions and unnecessary containment zones in our area? See, without any medication I got well, without any intervention from the doctor's side I got well. So why you are taking it so seriously? They often tell to us. Today's video is to once again remind you and tell you the facts about COVID-19 disease. The fact is that from the beginning of COVID-19 pandemic, the health authorities, the government and experts in this field have always made it very clear that when people get infected with this COVID-19 disease, clearly told that 80 to 85% of people who test positive will get well on its own. 80 to 85% of people who test COVID-19 positive will get well without any medication, will not need any medication, will not need any care by the healthcare worker other than getting them tested and advising them what to do in a situation when you need to go for home isolation. So it was clearly said that 80 to 85% of people, those who test positive, will recover by its own, because our human body has been made in such a way that we have our own immunity. Our body has the capacity to fight against any invading microorganisms, in this case COVID-19. So what the community people, what the people they are saying is also true, that any medication, without any medical help, person having tested positive with COVID-19 disease recovers completely within 10 to 14 days. So from the beginning we always said that 80% to 85% of people will get well. So that is true, that like any other flu, viral flu, the the patient will get well on its own, except that he or she has to maintain good hydration. If then the next 10 to 15% of patients of COVID-19 disease will need medical care. They will need to be reporting to the doctors for medication, for advice, for their treatment. They will be needing medication. So it is also very clear that 10 to 15% of people who test positive will be needing medical intervention. Maybe they will be needing to go to the hospital so that the doctors will monitor them. And from this 10 to 15% of people who will need medical intervention, who may need hospitalization, from this 10 to 15% also, many will get well, many will recover completely and go to home. But we need to remember that it is the 1 to 3% of the people among all the people who have tested positive will develop severe infections, will develop severe illness of COVID-19 disease, and they will be needing intensive care unit treatment and needing ventilation support. And this 1 to 3% of the patients among the whole 100% may die also. And it is the remaining 10 to 15% of patients will need admission in hospitals, and among this 10 to 15% of the patients who are needing hospitalization, a small tiny fraction of them will be needing ICU care, and they may be needing ventilation support. And among this whole 100% of persons, those who have tested positive, 1 to 3% of the patients will go to ICU, may need ventilation, and 1 to 3% of the patients may die. So our concern as healthcare worker is that no one should die, no one should go into ICU, no one should go into ventilatory support. So we are more concerned as healthcare worker that the deaths are prevented. Look at the size of the population of the nation, especially in India. India has a population of around 140 crores of people, and imagine even 1% or 2% or 3% of the population needing ICU care, needing ventilation support. Imagine the enormity of the patients in the country. Imagine the enormity of COVID-19 positive numbers in India if we take even the 1% to 3% of the population of India. That is a huge number. So this 1 to 3% of patients going into ICU, going into critical care unit, and imagine this 1 to 3% of the population, or 1 to 3% of the serious people needing highly advanced medical care. And in a country like India with such a huge population, 1.4 billion population, And if the COVID-19 disease strikes as many as number of populations of India, our hospital will be overwhelmed. We will be running short of beds and support system in the healthcare. So to prevent this tragedy, to prevent this situation, government is advising time to time to the citizens to maintain COVID-19 appropriate behavior. So post-COVID-19 disease complications are also very serious one. Many people have to follow up with the doctors for long duration. Many people have completely recovered from the infections, but they develop post COVID-19 pneumonia complications. And I have also known people, those who have recovered from the infection, but they develop post COVID-19 pneumonia complications, and even though they are testing negative after 10 to 14 days, but they cannot survive without oxygen. They are not able to live without oxygen support, and people needing continuous oxygen support is also a very difficult situation for the families to cope up. And I want to convey this message to you with great seriousness and responsibility, that please don't take COVID-19 easily. Please don't make comments like COVID is any other flu. COVID-19 is just a joke. Why are you putting restrictions to us? Why are you declaring micro containment zone to my locality and making us to stay inside the home for 14 days? And it's just a simple viral flu. Please don't go to such extent, because we don't know, once the population gets infected in large number, we don't know whose body will respond in what way. How your body will respond to the COVID-19 infection, how my body will respond to COVID-19 infection, you and I cannot foretell. Some of our close relatives may become very sick. They may go into ICU. They may be needing oxygen support, and some of them may die. So we don't know who will survive, who will respond well to the COVID-19 infection, and who will succumb to the disease. And when we don't make fun of it, to us, if you say, then we are very pained, because we have seen people dying from COVID-19 infections. We have seen young people, healthy people succumbing to COVID-19 infections. We have seen young people, those who have developed COVID-19 complications, and they are not able to live without oxygen support. And it's clear, and we need to know the facts. That is the doctors never said that everyone who gets COVID-19 infection will die. No, we never said. The experts from the beginning had clearly mentioned that 80 to 85% of people, those who test positive, will recover on its own. Why? Because of the capacity of the body, because of our immune system that is capable of fighting against this COVID-19 disease. And imagine a country like India, which has 1.4 billion population. This 1 to 3 percentage of people dying itself is a humongous number. So we have to be very careful. That's why government has been issuing regular advisory, and government has also not allowed for complete unlocking till today. And by the way, I want to share with you that is the percentage of people who have died or who have succumbed to this COVID-19 disease in India till the 1st August 2021 is 1.34 percentage. 1.34 percentage of the patients of COVID-19 disease have succumbed or died because of COVID-19 disease. This is the official figure, by the way. And that 1.3 percentage of people dying or who have died in India because of COVID-19 disease, that number comes to more than 4,24,000 deaths.